This voiceover is on the female breasts. Breasts are what you would consider a secondary sex characteristic, which means you can distinguish males from females. Would you agree or disagree that female breasts serve only the function of producing milk for the offspring? Female breasts do have a lot to do with female sexuality. However, men and women get wrapped up in the mysticism of the breast. Most of breast tissue is fat, and much of it is determined by heredity. It seems like a woman is never happy with their breast size. They're either too small or too big. They say that small breasts are just as sensitive as large ones, and I might argue that they are more sensitive because the nerve endings around the nipple are more compact and would lead to greater sensitivity. And no, you cannot exercise to increase the size of your breast. In fact, exercise would even reduce the percent body fat, which could make your breasts smaller. While we're talking about the size of a breast, size has nothing to do with the capability of a woman being able to breastfeed. There are 5 parts to a breast, the first being the nipple, and of course the nerve endings. A nipple can be flush with the breast, it can stick out, or it can even sink in. Those would all be normal configurations, and when exposed to the cold or becoming sexually aroused, the muscle around the nipple can contract, causing the nipple to become erect. The areola is the dark-colored area around the nipple. There are sebaceous glands here which would aid in breastfeeding, and also there might possibly be hairs around the areola which would be determined by the amount of hormones for that particular person. The mammary glands are what produce the milk. There are between 15 and 20 clusters of mammary glands. The milk ducts would take the milk from the mammary glands through the milk ducts out of the nipple. And again, most of breast tissue is fat. Here we have a picture of several breasts. The one on the left is that of a child. You can see the muscle, a small amount of fatty tissue. The mammary glands, very few of them, and very short milk ducts. The middle breast is that of an adolescent. You can see that there is more fatty tissue, a few more mammary glands, longer milk ducts. The one on the right is that of an adult, and then the picture at the bottom in the middle shows the areola and the nipple. On this slide, we're going to start on the right. That is the breast of a pregnant woman. You can see that when you become pregnant, your breast size increases. The mammary glands become more numerous. The milk ducts are longer. And then once she gives birth, then the middle breast would be that of a lactating woman. You can see that the mammary glands are full of milk. And then the breast on the left is that of a post-menopausal woman, a woman that has gone through menopause, an older woman. She's lost elasticity of the skin. She's lost body fat, so her breasts will be smaller. Lactation is the process of milk production. It happens between 2 to 3 days after a woman gives birth. A woman, after she has her child, she will want to put the child to the breast if she's going to breastfeed, because that sucking will actually stimulate the prolactin, which stimulates the milk production. And then the sucking also produces another hormone called oxytocin, and this stimulates the ejection of the milk. And it is going to take a couple days for the milk to come in, but with that sucking, the baby's first going to get a product called colostrum, and that will be very beneficial with lots of immunities for the baby. In fact, a lot of women who don't breastfeed want their baby to have that. So, of course, they start the sucking. That's going to start the process, which the milk's going to come in. And so if they're not going to breastfeed, then they may not want to do that. They used to give a woman a shot if she was not going to breastfeed. So she could breastfeed for a while. She could have that shot, and that would reverse the process. But we now know that that shot was killing some women. So obviously we're not going to give that shot to women anymore. So the woman will have to decide if she wants to breastfeed or not. We will eventually be doing a threaded discussion on the pros and cons of breastfeeding, so you can look forward to that. Your book will give you some examples of pros as well as the internet, so you can have this discussion with your classmates. And then this is just a slide that shows that the hypothalamus in the brain is what starts the whole hormonal process. And then the pituitary gland is going to also help in this process. And the two main hormones, again, are prolactin, which is helping with milk production, and oxytocin, which helps with the milk release. Here is a picture of an Afghanistan woman. She had twins, and she did not know that she could breastfeed both of them. Breastfeeding happens on a supply and demand. So the more you demand, the more supply you're going to have. So she could have breastfed both of her babies, but because she didn't believe she could, she had a boy and a girl. Guess which one she chose to breastfeed? The boy. Boys are more valuable in their culture. And as you can see, the baby boy is very healthy. The baby girl, we're not sure what is in that bottle. It could be formula at half the strength. It could be cow's milk, and babies shouldn't have cow's milk, whole milk, until they're 1 year of age. Or it could be that the water is not safe, that they have used to mix the formula with. Unfortunately, this baby is suffering from a malnutrition called marasmus. Her body is just literally wasting away. And I understand that a few days after this picture was taken, that the baby girl did die. And that is so sad, because this woman could have had 2 very healthy babies had she known she could breastfeed both of them. Because some women are not happy with their breast size, they choose to do a breast augmentation. Silicone used to be the one that we had most of the time, but that caused all kinds of problems. It would sag, it would be lumpy, and a woman could not do a breast self-exam. She couldn't breastfeed. If she would feel a lump, she didn't know if it was the silicone or if it would be cancer. So they proved to be very unsafe. They would leak and get into the woman's autoimmune system, causing a woman to have some health issues. Today, you might still see some women that have silicone, especially those women who have had breast tissue removed as a protection against cancer, or breast augmentation after they've had a mastectomy to remove the tissue because of cancer. A plastic envelope is more likely the way to go for women who still have all their breast tissue. And they basically insert the envelope next to the muscle and then fill it with saline solution. Yes, this does require surgery. However, they can breastfeed and they can do breast self-exams. So it's much safer to do the breast augmentation in this way. Here you just can see a picture of how that would be placed in the breast and really kind of act like a push-up breast. It's going to push up the breast tissue that's already there, helping the breast look larger. Here's a picture of a woman who had breast augmentation. On the left was before, and then afterwards, what her breasts look like. Here's a side view of that. And then here is a picture of an actress. Her name is Carrie Wurr. She thought because she was an actress, she should have nice breasts. So this was before, and this was after. However, she had problems with her silicone implants. Plus, she felt like all the attention was on her breast rather than her as a person. So she chose to have her breast implants removed. Here you can see they're measuring her to have them removed. She even had an unboob party the night before, and then you can see her after surgery. But she was much happier. She said she felt that people were paying attention to her instead of her breasts. On the flip side, many women feel their breasts are too large, and so they choose to have their breasts reduced. And this can become a medical issue. They have backaches, their bras are very uncomfortable, they cut into the shoulder. Women athletes, when you have large breasts, they just always seem to get in the way. Some women will wear like 3 sports bras so that they can hold in their breast as tight as they can so that it's not in the way. So many women choose to have their breasts reduced, and this process has become greatly refined over the years and is very safe, and women who have had their breasts reduced have been pleased with the results. Breast cancer is probably the biggest concern for our breasts, and with any kind of cancer, early detection is the key. About 46,000 women die each year in the United States, and we do not have to have that. We can live without our breasts. If breast cancer is caught early, they can be removed, which is called a mastectomy. If you have both of them, it's going to be a double mastectomy. But when that breast cancer spreads to other vital body parts, that's when we have the concern. Men, you are not immune. About 240 men die annually, and breast cancer is the number 2 cancer in women, second to lung cancer. And overall, about 1 in 9 women die annually. A woman is at greater risk if her mother or sister has had breast cancer. Other risks are having started your period earlier than age 12, delaying your childbirth until after you're 30, never having given birth, being on hormone replacement therapy, that can put a woman at risk, heavy drinkers. There's also a gene mutation which can cause cancer, and this is particularly women who are younger than age 38. And then it's, again, not the cancer of the breast that causes death, but when it spreads to vital body parts. And this just shows that the older we get, the greater the chance we have of getting breast cancer. So it's very important to do a breast self-exam once a month. And they say the best time to do this is the week after our period. Our book says 12 to 16 days after the first day of the woman's last period. To me, that's really wordy. And so I would just like for you to remember the week after your period, there's less hormonal things going on during that time, and so it's easier to check. And then once a year, you need to go in for your annual doctor exam. And when you do your pelvic exam, they also do a breast exam. Here is a picture of a breast exam being done, and it's really a twofold exam, a visual exam. So stand in front of the mirror, hold your arms down, hold your arms up above your head, get used to what your breast looks like normally so that any change can be noticed. Then, when you're in the shower or lying down, do the actual manual examination or feeling of the breast. Hold one arm behind the head and then use the other hand to test the breast. What you do here, you're stretching out the tissue so that you can feel for any lumps. And this picture shows it going around. I really don't like this picture because it shows maybe you don't have to test around the nipple. No, you need to test around the nipple. So maybe going up and down across the breast is a better way to do it. And then also make sure you feel up in the armpit area. There are lymph nodes there that can become cancerous. So again, a twofold examination, visual and manual. Then once you're 40, or when your doctor recommends, it depends, if you have a mother or grandmother or sister who's had breast cancer, you may need to have a mammogram earlier. It's a special x-ray to detect small lumps. Again, early detection is the key. Mastectomy is the surgical removal of the breast. Some women may just have to have a lumpectomy, which they would just remove only the lump and some surrounding tissue. And most lumps are cysts or a benign, which means non-cancerous tumor, known as a fibroid edema. And then this is a picture of a woman getting a mammogram. It's the machine with the mammographer helping her do this test. So she can get the results usually fairly quickly, within a day. They can give you the results of the test, and hopefully the results will be that you are cancer-free.